Taylor, we ready? Perfect. Good evening. Just want to call to order the meeting for the Health and Human Services Subcommittee. Today, we only have one analysis that will be happening. That's MDH, Developmental Disabilities Administration. And we have the phenomenal Morgan Smith as our budget analyst to read it out.
Thank you, Mr. Chair, members of the committee. My name is Morgan Smith, and I'm here today to present the operating budget analysis on the Developmental Disabilities Administration, also known as DDA. DDA provides direct care services to intellectually and developmentally disabled individuals across the state, and this is primarily through state facilities and community-based services. As you'll see on the first page, DDA's budget in fiscal 2024 increases 93.1 million or 5.3% to 1.86 billion. We're going to skip now to page 5. Page 5, Exhibit 1 shows the number of individuals served by DDA across all DDA waivers. One of DDA's primary goals is to increase the number of eligible individuals who are receiving community-based services and enrolled in HCBS waivers by 0.3 percentage points over the prior fiscal year. Enrolling individuals into home and community-based services waivers allows for claiming of federal funds for services provided. And as shown in the exhibit, fiscal 2022 saw 17,186 individuals receiving community services who were enrolled in DDA waivers, which was an increase of 3% from 16,716 individuals from the prior fiscal year. However, at the same time, the total number of individuals served in community services outside of those receiving case management also increased significantly from 17,112 individuals in fiscal 2021 to 19,506 individuals in 2022. This has caused the overall percentage of those served in DDA waivers to decline from 98% in 2021 to 88% in 2022. This is the lowest level of individuals served in all DDA waivers since fiscal 2018. Where the percentage had also hit 88%. And because of this, DLS is asking MDH to comment on the reason for the slippage in the share of participants qualifying for the waivers and efforts to increase the percentage of individuals served across all DDA waivers. DDA offers 3 waiver programs under Medicaid, and they're listed here on the bottom of page 5 and onto the top of page 6. They are community pathways, community supports, and family supports. The difference of these waivers is outlined, including the number of individuals utilizing them in each of these bullet points. DLS asks MDH to provide an update on the current number of filled and available slots, as well as efforts to fill any remaining slots that may exist. We're going to jump to page 7. Exhibit 2 shows the point in time community services waiting list counts. DDA tracks the waiting list for over 3,800 individuals who meet the statutory requirements of having a developmental disability. You'll notice that these are broken into 3 priority categories, with crisis resolution being those with the highest need, and these individuals are typically at risk of harm or homelessness without services. Current request, which is at the bottom of this data chart, are those with the lowest need, and those are typically individuals who are not at risk of harm or homelessness without services. In recent years, the number of individuals on the waiting list had been decreasing, but in fiscal 2022, DDA saw an increase of 0.7% to 3,805 individuals from the recent low of 3,777. Individuals who only receive support services who do not meet the statutory requirements of having a developmental disability were not included in this graph or in the table, but including those individuals into the total count of folks on the waiting list brings the total number of individuals up to 6,046. DLS asks DDA to comment on the status of efforts to reduce the waiting list. We're going to now move to page 8, Exhibit 3. Exhibit 3 shows the balance of the waiting list equity fund. This fund was originally established to ensure that funding associated with individuals served in state residential centers followed them when they moved from those residential centers to community-based care settings. Exhibit 3 highlights the growth in that fund over the last 5 fiscal years, and you'll see that in fiscal 2022, that fund balance reached $12 million. It is primarily grown due to low spending of the fund and Just to note, between fiscal 2021 and 2022, the funds saw the smallest year-over-year growth in recent history at only $617,500. We're going to move now to page 9. Page 9 begins the discussion of deficiency appropriations seen by DDA. On this page, we'll talk about the home and community-based services enhanced match. And then on the following page, there is a discussion of the other deficiencies that are included in the budget this year for DDA. The American Rescue Plan increased the federal Medicaid assistance percentage for qualifying Medicaid home and community-based services spending by 10 percentage points from April 1st, 2021 through March 31st, 2024. The amount of the match must be reinvested in home and community-based services by March 31st, 2024. And language in the fiscal 2022 budget required DDA to spend at least 75% of these federal funds attained from the enhanced match for a one-time rate increase for home and community-based services providers. The other 25% will be used for other purposes that are outlined in the text. DDA had initially planned to set aside about $10 million for competitive grants that would have been created with the federal fund savings. The Centers for Medicare and Medicaid Services subsequently reported that the DDA grants could not be used for capital investments or ongoing internet connectivity efforts. DDA then reported in its most recent spending plan that it would amend the amount originally set aside from 10 million to 5 million, and this 5 million is included as a deficiency in this year's budget, and its purpose is to assist providers who are transitioning to the long-term supports and services program in obtaining equipment and information technology software. To this end, DLS requests that MDH comment on why ARPA funds for competitive grants for IT infrastructure is a permissible use of funds, including whether other uses, including whether there were other uses that could have resulted in federal fund participation and whether those were considered. As I said before, other deficiency uses are listed in the middle of page 10, including 17.7 million in federal funds for the remaining portion of the enhanced federal match before the full phase out, as well as grants for post-secondary education grants and support for projected shortfall in the community services budget due to higher spending. We're going to now move on to page 11, Exhibit 4. Exhibit 4 talks about the overview of agency spending and breaks down the budget. And you'll see that the majority of DDA's budget is dedicated to provider payments within community services at 99%. The remaining 1% is used for program direction. And within the 99%, you'll see that about 57% is used for residential services. The fiscal 2024 allowance also accounts for increased spending in self-directed services. That's that green triangle. And that is primarily due to the self-directed services bill, chapter 736 of 2022. And that is an initial increase of about 15.8 million in general funds. Overall, self-directed services account for about 10% of the total budget at 191.3 million. We're going to move to page 12. Exhibit 5 shows the proposed budget changes, and this wraps onto page 13. Most of the change in the agency is within the community services program, and the majority of which is about 117.5 million, and that covers the waiver services, new placements, and the 4% provider rate increase that you'll see in this chart is about 66 million. It also includes 20.8 million for an increase in day and residential services for their the providers within those services for their transition to LTSS, as well as day and employment transportation increases. And then on page 13, you'll see the personnel data chart. And in fiscal 2024, DDA gained 5 regular positions, but this was primarily from realignments across other areas of the department. And there's also a net increase of 14.09 contractual full-time equivalents listed in that second bullet point. We're going to now move to page 14. Page 14 begins the discussion of some of the reports that we got over the interim, and in particular, reports on the community services utilization data collection and spending forecasts. Language in the fiscal 2023 budget withheld $1 million from DDA in general funds for administration until the department submitted quarterly reports outlining some of the data that is surrounding utilization and spending forecasts. The first report was submitted on July 13th and the funds were released August 25th. The second report, which was submitted November 1st, 2022, was found to provide insufficient information, and so we continue to withhold the funds. And as of the writing of the analysis, the third quarterly report, which was due January 1st, had still not been submitted. The information that the reports were to include are listed in those bullet points below, so I'll let you read those at your leisure. DDA is moving from a prospective payment model to a fee-for-service reimbursement model, which includes moving billing functionalities from the legacy provider consumer information system 2, also known as PCIS 2, to the long-term supports and services system, also known as LTSS. LTSS is already being utilized by other Medicaid programs across the state. MDH continues to transition individuals and providers to the new LTSS system for billing. And as of September 1, 2022, 70 providers and 5,969 participants, or nearly about a third of all DDA participants, were fully transitioned to the module as shown here in Exhibit 6. And Exhibit 6 takes each phase of the transition with dates and then tells you how many providers and participants were transitioned in that time period. As DDA has not yet provided a timeline for additional transitions, MDH should comment on the updated timeline to transition individuals and providers to the new LTSS system, the share of providers and participants who have and will need to be transitioned, and the projected date for completion. Now moving to Exhibit 7, which is on page 16. Subsequent to the submission of the quarterly reports, DDA shared provider population data on those who had transitioned to LTSS. And Exhibit 7 on page 16 shows both providers transitioned to LTSS and total providers by size. There's a higher portion of large providers who have transitioned to this new system, with about 51% of all large providers having transitioned. In comparison, you'll note that only about 17% of small and 23% of medium providers have transitioned in the same timeframe. The Hilltop Institute completed a fiscal impact analysis to examine the difference in payments to providers between the two payment models. And the analysis received data from about 84 DDA providers who voluntarily self-reported information. Hilltop notes that in the report, because of this, providers were not necessarily a random selection, nor were they necessarily representative of the entire provider population. And between the models, the new LTSS system showed an increase in the average reimbursement to providers by about 1.41 million or 18.2%. It's important to note that day providers were an outlier in this data, and they reported an average decrease of about $90,000 per year. We're going to now jump to Exhibit 8 on page 17, which shows a cost analysis of the rates paid to providers that were transitioned. And it provides information of about 5 providers or 588 consumers. And those were primarily individuals who were part of the early adopter group. The revenue, as seen in this exhibit, grew by about 32% between the two systems, and that is what they're being paid in LTSS as it compares to what they would have been paid in PCIS 2. Because of this, DLS asks MDH to comment on the generalizability of the data to the larger provider population and the expected increase in state revenues as a result of the fee-for-service payment model. And this should include whether the fiscal 2024 budget contains adequate funding to support providers who have or will transition to LTSS. There's also on the next page a short discussion of the repeat audit findings that were found in an OLA audit from October 2022. These repeat audit findings, there were 4 of them, came out in 2022, and then OLA offered several recommendations that are listed in bullet points on this page that I will let you read at your leisure. And because of that, DLS recommends adding language restricting funds pending the resolution of repeat audit findings consistent with the request of the Joint Audit and Evaluation Committee when an audit contains 4 or more repeat audit findings. On page 20 and through page 23, there are other recommendations made by DLS, and I'll just walk through them briefly. Item 1 recommends restricting funds and community services that would be utilized for the transition of additional providers and consumers to the LTSS system until MDH submits a report to the budget committees detailing the number of providers and participants to be transitioned, as well as a forecast on the estimated increase in payments as a result. This item would be due July 1st, 2023. Item 2 is annual language that requests continued information on the transition to LTSS, including a general fund forecast, utilization by service type, the number of individuals transitioned, a cost analysis of rates paid to providers as it compares between the two systems, a breakdown of providers transitioned by size, and an updated timeline for transition. This would again be a restriction of $1 million, and it would be broken down in $250,000 pieces per quarterly report submitted. Item 3 is the previously mentioned language from repeat audit findings. Item 4 would restrict $100,000 until a report is submitted that explains the decline in community services participants being served in all DDA waivers. And this is primarily because MDH is losing access to additional sources of funding when individuals are not enrolled in waiver programs where federal fund reimbursements are provided. And lastly, item 5 is an annual language that has been in the analysis for a couple of years that restricts the appropriations made for community services to that program only. On the following pages, you'll find an update on the status of the federal disallowance, discussion of the JCR reports that were required last year, the audit, and other appendices. And with that, I conclude my testimony, and I'm happy to take any questions you might have.
Thank you, Ms. Smith. Seeing no questions at this time, if we could bring up Dr. Scott and Deputy Secretary Simons for the agency's response.
Good afternoon, Chairman McCray, members of the subcommittee, Laura Herrera-Scott, Secretary of Health. With me is Bernie Simons, Deputy Director of the Developmental Disabilities Administration. Also available for questions are Emily Brandenburg, our Chief Financial Officer, Robert White, our DDA Operations Director, Nicholas Gabor, Finance Director, and Webster Yee. Ms. Smith, maybe it is magnificent now per Chairman McCray, but thank you for, as always, the thoughtful analysis that you provided. I want to take a moment to thank Disability Secretary Carol Beatty. I don't think she's here, but she's taken over the last few weeks time just to connect the dots on how our agencies are working together. And certainly Bernie Simons for his leadership and work together in most recent years. I look forward to continued collaboration with state agencies and our valued community partners, some of whom are sitting behind me. And we know there's a lot of work yet to come. We want to certainly be committed to DDA's mission of creating a flexible, family-oriented system so people can live their lives. And we know these practices are rooted in health equity and certainly consistent with the governor's goals. Before I turn it over to Bernie, just want to call out a few highlights in our budget response. My North Star is and always will be what is best for the individual. One of my principal goals over the next few months is to really understand DDA's wait list so that we can minimize wait times and get as many people the services they need. Similarly, we are approaching some key points in the transition from a prospective payment system to fee-for-service via the LTSS DDA module. So ensuring successful transition is certainly a priority. And with that, I'll turn it over to Bernie, who will give a summary of our response. You have our written responses in front of you and supplement with any details, and ready to answer questions at the end.
Chair, members of the committee, thank you, Secretary Herrera-Scott. So I'm Bernie Simons, I'm the Deputy Secretary for DDA, and it's good to be here, and we'll go through the responses. So the first question was, we should comment on the reasons with the slippage and the share of participants qualifying for the waivers. Our data in DDA, when we pulled it, is not necessarily matching what we received from Department of Legislative Services. I think the problem is that we've got a foot in both systems. You know, we're in our old legacy system of PCIS2, and we're pulling data from that. And we're also pulling data from the new system we're going into, long-term supports and services, so that it'll enable us to do fee for service as legislation called for. Get out of the prospective payment, get into fee for service. So with having a foot in each one, we're not really sure who's looking at what piece of data. So we respectively ask for a meeting with TLS. And then once we get on the same page with the data points, then we will be resubmitting a response to the chair and the committee. MDA should provide an update on the current number of filled and vacant waiver slots. So we have, as the analyst said, 3 waivers. We have the community pathways, the community support waiver, and the family support. Those total about 19,500 slots for people. And so where we are right now, we have 18,150. That's a 93.4% filled rate. And we have 133 slots available. Now, in the document you received probably has something called reserve category. And I want to direct your attention to a couple of years ago, we had legislation that said, what happens if a family's in the military and they have a son or daughter in services with DDA and they get transferred out of state and they go to wherever, and then sooner or later they come back into the state. What we did is we said we'll have reserve capacity that was attached to that legislation so that the individual who's moving back with their family doesn't have to go on a waiting list. They go automatically back into services. So we have these reserve capacities that are like fenced off, for lack of a better term. And, you know, they're like for a transition in youth that we've had funding for many, many years so that they can get into services right away and not go on a waiting list. So this is a way that we have people not going on a waiting list and they qualify for the categories they're in, because as you know, from the Department of Human Services, we have kids who age out from there. We have kids who age out from State Department of Education. So as they come in through that pathway, they can come in and be eligible for the services as we identify them and work through case management entities. Next question is, DDA should comment on the efforts to reduce the waiting list. I'd just like to go back and revisit from a couple of years ago where we were. As the analyst talked about, our 2 highest categories are crisis resolution and then crisis prevention. And that's like somebody needs something immediately or somebody needs something within the next year or so. And so we've been fortunate to have enough money because when I started, all we could address was the crisis resolution, and we could not do the next category down. And so back in 2017, we had 780 people in those 2 categories. Skip 2 years to 2019, we went from 780 to 519, and currently we have 178. So in my mind, from 780 to 178, it's been significant progress that we've made with the funding that we've received from the legislature, the governor, et cetera. We also have, I think, had support back a few years ago when we only had the community pathways waiver. And then we obviously went with the community supports waiver as an additional waiver, and the family supports waiver, which is for kids under 18 to help families nights and weekends because we can't take the place of the school system. And we think with those numbers that we've seen, that's attributed to the decrease in the amount of people. So again, I think we've done a good job. Let me just emphasize that in 2022, in our highest category of crisis resolution, there are only 2 people. And when we get down to the next level, there's 176. So, you know, as we continue to move through and we've got additional waiver slots, we will be addressing the 176 as we move on. The department should comment on the use of the ARPA funds for the competitive grants related to IT infrastructure. So when the department submitted the letter to Center for Medicare and Medicaid Services, we basically said we need to help some of the smaller providers who have not transitioned into long-term supports and services. And if I could just paint the picture that currently in our legacy system, we pay the providers on the front end. And so then they go back into our quote unquote PCIS system and basically say, yes, there's an attendance. When we get into a fee-for-service model, this is billing in real time. And so the providers basically do not have the IT infrastructure to basically say, how do I collect data? If I'm out in the community and I am with Laura and we're there and, for the first hour of the day, we're doing community supports. The second hour, we're doing competitive employment, et cetera. That needs to have codes, right? Just like when you go to the doctor and they all have codes, right? For, what's your diagnosis and all that stuff. We had to create all of that as we went along. And so as we transition, I think we'll get better. We'll continue with this, but they need that IT infrastructure in order to get the data so that the data from their agency can then be uploaded into the long-term support and services so that they can get their billing in real time. And so again, in their payments in real time. So again, it's not so much about the old legacy system as much about modernization of what we are currently doing. And as we move forward with that, we do have some providers, and which was the next question about what are we doing with transition providers into LTSS. So we've been doing this. We started with a small pilot. We moved forward with that. And as of last November, we had 174 providers of our 239 providers that DDA contracts with, for lack of a better term. 56 of those providers were in 100% of the services that they provide to the individuals in their agencies. And so as of this April, because we have another cohort coming in of providers, either coming in new or expanding their services from the old legacy system into the new, we, by April, will be at 191 providers. So we've gone from 56 providers that are billing for 100% in their agency to 87 providers. So that's been a pretty good increase from 25% to 37% of our providers. And so again, as we keep moving forward, our projections are that we will have all providers in by December of 2024. Because obviously there's a readiness, there's the IT systems, there's looking at person-centered plans, there's looking at all kinds of foundational work that needs to be done in order to be successful. Because what we don't want to do is we don't want providers to be out there providing and then not getting a payment. The next question was DDA should generalize on the data for the larger provider populations and what the expenditures would be. And we looked at that, and we had a very small sample that was in Exhibit 8. It was based on a sample of 5. What we're requesting is to wait on that. We do have more providers coming in. It'll give us more data points. And in the Joint Chairman's report that is due, we'll update those as we move forward and continue to make sure that you're seeing the progress in the initial data points that we have. MDH should comment on whether individuals who collect billing can utilize a data exchange. Right now, the Medicaid providers that are doing fee-for-service have the ability to look at all of the available data relative to their agency. And then the last one was DLS recommends adding language restricting funds until there's resolution on the audit findings, and the department is in agreement with that. And that ends my presentation.
Thank you, Dr. Scott and Mr. Deputy Secretary. Just a couple questions and want to make sure that you all get the opportunity to comment on some of the written testimony that was written. But when you talked about response number one, could you just say like when? I know you said you're going to have the meeting with DLS, and then once you have the meeting with DLS, when do you, what's like a tentative outline of when you think that we will be able to have that?
I would hope within the next week, depending
Okay.
upon, my staff will be available.
Got it.
So it's, we'll move meetings and this needs to be done.
Got it. When you talked about the ARPA dollars and in reference to the IT pieces, I'm assuming that some of the ARPA dollars provided matching opportunities. Does the IT piece still provide some level of a matching opportunity?
Some of the ARPA funds already have gone out for provider rate increases, et cetera, and that drew down the federal match. When we put in, as the analyst said, the $10 million, they said, no, you cannot match that. And, we really didn't have another opportunity except to look and say, this is what we need to do because they need an infrastructure. Excuse me. And there was no other cash available for the state to get to the providers for them to say, okay, I need to go out and buy this IT platform so I can collect the data.
So the short answer is no.
Yes, ma'am. Thank you. In reference to the ARPA dollars, once again, and thinking about the small providers, are we utilizing some of the ARPA dollars intentionally to the small providers that will have a challenge with the transition?
I'm sorry, can you repeat that?
About the ARPA dollars for the small providers. Wasn't it made available to everyone?
So the ARPA, we've already had money that has gone out to all of the providers who have applied. We had grants a couple of years ago through CHRC, right? The Commission on Health. We worked with them. Excuse me. We had federal money and grants go out to that. We've been working this right along with any federal money from the ARPA money that we can get in to get out to the providers and either assist them with IT issues, assist them with rate increases so they can pass it on. I mean, they all had a real difficult time, as many did, and other businesses during the pandemic with not having employees. And so, and then we had a lot of families who said, I'm not sending my kid out. I'm keeping my kid home. I don't want them exposed to anybody in COVID. So we had to do a lot of workarounds with all of that stuff.
Yep.
Can I just, to the point about the small providers though, we still have, to the numbers that Bernie cited, about 45 providers that have not gone into the system with even one service. So we're going to have to look at those providers a little bit differently to understand what are the issues from them at least getting into the system with one service. So that's a deep dive I'm going to be looking at with the rest of the team because I didn't realize that's a large enough N that we may need to treat them a little bit differently than everybody else, because everybody else we have, as Bernie said, 85 providers that will be all in by the end of March. And we have 106 that are touching at least 1 to 2 services. So they are moving through the system, but those smaller providers haven't done anything yet. And so we need to understand why.
Dr. Scott, I just want to say ditto to that piece of it. If there could be a level of intentionality, we have written testimony from the small providers that basically say that they're concerned to a certain degree about how that transition takes place and whether they can handle that transition. So just want to make sure that we leaned in from that piece of it.
Yes,
just
they're
know
going
that
to need to be treated a little bit differently to understand what the issues are. And then in addition to the IT infrastructure that's been supported to figure out what more they need to be able to make that transition, at the very least to test the waters with putting in one service.
And please know that the subcommittee has an interest too. In reference to the response about the small group of folks that voluntarily and the number being accelerated, you recognize in your comment to say, hey, this is a small sample size.
Right.
I guess the question is, does that number at the moment give you any level of concern? Obviously, you stated that you need more data from that standpoint, but is there any level of concern about the price points or the dollar points that are being hit at this moment?
For me, no, I think after this next cohort goes through, like I said, we'll have almost half through the system by the end of March, beginning of April. And I think that's when we need to do, because we'll, whatever 85 is of 236, I'm not going to do the math for you right now, I'll get it wrong, but whatever, it's a big enough percentage that I think that would be the time to evaluate whether or not there's something that we need to take a deeper look. And we do have a pause built in there to do just that, to evaluate now that almost half the providers have gone all in, what does that look like? And what adjustments, if any, do we need to make?
And I know that we talked about this earlier, but obviously there's testimony that sits here from some of the providers in reference to the data sharing piece. And it sounds like you all are going to collectively get with the providers to be able to work through that. Just know that the committee has an interest in just understanding like what did that conversation sound like from that piece of it. If I can move on to like rental subsidy, I'm under the perception that in 2023 there was some portion within the DDA budget to deal with some level of rental subsidy, and just would like to understand how we're thinking about that in fiscal year 2024. From that standpoint.
Yeah, we worked with the Department of Disabilities. They have a unit that deals with housing. And then we worked with the Department of Housing and Community Development. And so our model is changing. So if you look at our statute years ago, it basically said, if you are going into a residential service, i.e. a group home, it's going to be provider owned or provider leased. So we heard from a lot of advocates that, and a lot of other states do this, that the individual should be able to rent their own home. And then, then they keep their place. So, and then if they don't like their provider, they don't have to move out of their home. They stay there. Currently, if you're in a group home and you don't like your provider and the provider owns the residential site, you got to move, right? So it didn't make any sense. So what we did is we said, okay, but housing is extremely expensive. So how do we leverage this? And then we have the Maryland Inclusive Housing. And I think they're here to give testimony later. And we've done work with them. And they kind of like are a facilitator working with different housing entities, either in Baltimore City or in the counties throughout the state, to say, how do people leverage from a local level and not just from the federal level, like when everybody talks about it's 811 vouchers, et cetera. So we had money in there. I think we did about 100 or so folks to assist them with rental. And obviously, before we become the payer of last resort to DDA, because we're not about housing, but you've got to be able to prove that you went to the local social services, you went to your county housing, units for assistance, all of these things before we would use DDA dollars.
Yep. If you can get back to the committee with what was the amount in fiscal year 2023, is there monies in the fiscal 2024? And if you would be asking for some of it in the supplemental, if it's not in the fiscal 2024, would be helpful. I'm gonna go to, I believe my last question, and this comes more from the written testimony that was read. They talked about transitioning youth initiatives. It talked about the eligibility division determination and the time frame in which that is happening. So like, and what I say about the challenges in the time frame, like how long the time frame was happening. If you all would like to comment on that, because it was written testimony.
So I'm going to tell you, we're not prepared to comment on that. That was an issue that was also mentioned yesterday, and we'll have to get back to you with a response.
Yes, ma'am. I appreciate that. I see
So
Senator
just so I'm
Zucker.
clear, it's transitioning youth, the timeline and the number.
It said transitioning youth initiative. It talked about the eligibility division determination, and it said that we still had services as back far as July 2022, and we're in 2023. Senator Zucker.
Thank you very much, Mr. Chairman, Madam Secretary, Deputy Secretary. The Deputy Secretary just had a quick question. So thank you for the report with End the Wait. At this point, how often are you making sure that the lists are like up to date with those people that are waiting for services?
Oh, as soon as they come in.
I guess I'm sorry, let me rephrase that. So once they come in, how often are you checking back to make sure that they're still in Maryland, that they're still eligible?
So when we have, we work through the case management and the regional offices, and they go out and we'll have case management discussion with the individual about what services do you need, et cetera. And so that's when we start the process of getting them in the system.
Right, but what
So-
about if there's a wait? So like, for instance, some of the waivers have a long wait and there's like, backlog. So how often are you guys checking in with them?
We don't have a long wait. We have numbers, but we don't have a wait because we got the available slots.
Got it, okay.
If I'm understanding the question.
Okay.
I think if I'm understanding the question, is of the wait lists, how are we reprioritizing the wait list as people either get services or move out of the state?
Correct.
And how does that number change over time?
Correct.
Okay, we'll have to get back to you on that.
Dr. Scott, seeing no more questions, first, I'd just like to thank Ms. Smith for your diligence, commitment, dedication, in reference to what you do for the state of Maryland with the analysis. And Dr. Scott and Deputy Secretary Simons, equally, just thank you for what you do each and every day. At this time, colleagues, we're going to move to some of the public testimony. The first person that we'll call up is Devin Wiley from People on the Go, Maryland.
That would be you, Mr. Chairman.
Yes, sir.
I'm testifying in place of Devin. She had to find me up.
Thank you, Mr. Chairman, distinguished committee members. For the record, my name is Matt Rice. I am the Executive Director of People on the Go of Maryland, which is Maryland's statewide self-advocacy organization ran for and by those with intellectual and/or developmental disabilities. POG is here today to testify in strong support of the Developmental Disabilities Administration budget because the over 400 members that I am answerable to, the majority of them receive some type of services through DDA, and I receive services through DDA myself. I think we all know that this is a positive budget. It has funding in here for individuals on the wait list, as has already been discussed, individuals in transition, et cetera, et cetera. But I want to be clear that the funding as it stands should be preserved. So we're hoping that no changes are made. And I also want to be clear that while this is an excellent budget, it doesn't address fully the issue of the fact that we still need to do work with our provider rate system. My colleagues who are far more well-versed in this issue than I am will talk about that. But what I will say is that right now, individuals and families are having trouble getting services from providers just because providers don't have what they need to fully support the people that they want to support. So people are being forced into self-directed services. I self-direct myself, and it is a great alternative, but it's not for everyone. It requires a lot of responsibility and a lot of dedication on the part of the individual and/or the family or support system. So it may not be for everyone. I want to say in closing that the providers are still the backbone of our service system, and we are still in the worst direct support workforce crisis that we've ever seen. So we need to make sure that we address these issues and that people have the freedom to choose. Thank you very much.
And thank you, Mr. Rice, and thank you not just for the work that you're doing for the 400 members, but what you're doing for across the state of Maryland. Thank you again.
Thank you, Mr. Chairman.
Yes, sir. Colleagues, at this time, we're going to bring up Andy Culp, and he'll be representing the ARC of Maryland.
Good afternoon, Mr. Chair and members of the committee. My name is Andy Culp, and I'm here on behalf of the ARC Maryland to testify in support of the governor's budget for DDA. We're truly grateful for all that's included in the 2024 budget. We're also grateful to DDA for the recent family forums that they've held to engage family members. So I wanted to make sure you are aware that that's happening. So there's Laura Howell is going to speak to specific components of the budget. So I wanted to just focus on a couple of things, echoing Matt Rice's remarks about true choice for people with disabilities. Even before the pandemic, our historically insufficient rates have increased demand for entry-level positions throughout other areas of commerce, and it's led to a decline in our direct support professional workforce. So this is an endemic problem for us. It's something that we've always experienced, but it deepened, especially through the years of the pandemic, and it continues. As we have other people that are looking for caregivers in the healthcare system and all the stress they experienced. So people are, families are telling us they want to be in a provider, or people want to be in a provider. They don't want to self-direct their services, but the providers are so strapped for direct support professionals that people are, for timeliness, are going into self-direction. So we do want self-direction as a model for people, but we want it to be a choice, as Matt said. So the last thing I wanted to point to is something, Mr. Chair, that you brought up, and that is about our concern with the eligibility determinations for Medicaid. We are hearing from providers of the ARC that this is an issue. And I just talked to a coordinator of community supports who confirmed that EDD is behind. They're the ones who determine people as eligible for Medicaid, which might explain why there was a lag in Medicaid matching, and we need those federal funds in the state. So I'm not saying that the DDA control issue, but it's within the Department of Health. And as the public health emergency unwinds and people need to start redetermining for Medicaid, there's only going to be more load on EDD. And as we end the wait with the End the Wait Act and more people try to enter services, they're going to have to be determined for eligibility. So it needs to be addressed sooner than later. Thank you very much for hearing my testimony.
And thank you, Ms. Culp. At this time, Executive Director, how would you?
Good afternoon, Mr. Chairman and members of the committee. I'm Laura Howe, the Executive Director of the Maryland Association of Community Services. We're a statewide nonprofit association with about 120 community providers that you've just heard a lot about. We represent about 80% of the funding for community supports across Maryland. And thank you for all of your support. We are very pleased with Governor Moore's budget, including the acceleration of the rate increase tied to the acceleration in the minimum wage, as well as the $20 million for an increase tied to the new rates. And of course, all of the expansion funding. I just wanted to make a couple of points. The first one is, while the budget is very bright, the status of rates for meaningful day services remains very concerning. And as noted on page 17 of the analysis, this issue is really most, the issue for daytime rates. So that's employment, community development, and day habilitation services. It affects a large number of providers. It is hardest on providers that only provide those services because they have no other revenue. They're only reliant on that funding. And it has a couple of important impacts as we look forward. So I want to say, as a member of the DDA Rate Review Advisory Group, and I'm very pleased that DDA has asked me to be part of that group. I work with a certified actuary that we have on contract to review each version of the proposed rates. And there is no question that the rates, as pointed out in the analysis, are inadequate. This has a couple of effects. One is that it means that we really struggle to support new people. So people on the waiting list, I know that's been an important issue for many of you. And it also affects the ability of those providers to transition to LTSS. So we just talked a lot about that transition. And because when you transition to LTSS, you also agree to accept the new rates. Day-only providers can't make that. It is really fiscally unsound to make that decision. So addressing the day habilitation and the meaningful day rates across the board is really critical, both to expansion and meeting the need for transitioning youth and people coming off the waiting list, and critical for helping to get all of the providers across the, across that finish line transitioning into LTSS. So really urge the department to address that sooner rather than later. The discussion has been that it might not be addressed until FY25 at the earliest, and we really believe that that needs to be addressed earlier than FY25. The last point I just wanted to make, the discussion about the exchange of data. Thank you for raising that issue. I was a little perplexed by the characterization that providers have had access to all of the data that they have, appropriately requested. We haven't seen that. We know it's been an ongoing discussion for several years. So I'm really glad to hear that that discussion is going to happen with the department and the appropriate providers. So thank you for all of your support, and we urge you to support Governor Moore's budget.
Thank you, Madam Executive Director. At this time, I believe Ms. Huffman, you all want to come up. It's not on the list, but please.
Good afternoon, Chairman McCray, members of the committee. My name is Tim Weens. I am the Executive Director of Maryland Inclusive Housing, MIH. MIH is funded by DDA to assist individuals with IDDs to successfully attain and maintain affordable, accessible housing of their choice. It's what Mr. Simons was talking about earlier, moving to a new model as Maryland moves from a group home model to more of a supported living model. $250,000 is included in the budget to support the work that we do, and we would ask you support that appropriation. Our written testimony includes a more full description of the work that we do. We also, as you referred to, Mr. Chairman, are very interested in the DDA rent subsidy program, and the staff that we have are working and have been working to access affordable housing in many ways from many different sources. But the addition of DDA funding and their rental assistance program is an important part of that piece, because the pie isn't getting bigger for all the people that need affordable housing, and we appreciate money coming in to help do that. We had recommended that there were 35 people that were funded in the current FY23 year, and we were recommending 100 additional people be funded in FY24. The annualized cost of that would be $1.9 million, but they're not all going to come in on July 1st, so we wouldn't necessarily need that full amount for FY24. The program is projected to grow each year. It's a new program, and it needs to find its way, and eventually funding approximately 500 people when it's fully implemented several years from now. The other recommendation request we have, I guess, to you is we had submitted a plan to the Westmore Transition Committee to partner with private developers to create more integrated housing throughout the state. And we would just urge you to urge them to work with us to try to implement that proposal. Thank you for your time.
Hello, Chair and the committee. My name is Sharonda Huffman. I'm the Director of Housing for Maryland Inclusive Housing. But most importantly, I'm also a mother of an individual who has an intellectual and developmental disability. His name is AJ. I'm also a constituent of Baltimore County, and I have worked for years in Baltimore City. I also supervise housing committees throughout the state. But most importantly, as a mother, I had to deal with something that Ms. Culp discussed, the waiting list and eligibility. So in 2021, my son graduated from high school during the height of the pandemic. At that time, my son regressed because it became an opportunity that he was never going to go back to the school he went to for 7 years. My son actually went to Pittsburgh. We had to take him to Pittsburgh to actually get help for him because it was too much of a wait time in the state. So he stayed there for 3 weeks. And our team decided that it was best for him to probably go to a group home. He probably regressed because he wanted his independence. AJ now lives in an apartment with one roommate in Baltimore County. And he really loves his own space and the opportunity to be independent. Recently, the HUD secretary addressed the Fair Housing Act's affirmatively furthering fair housing mandate. Persons with IDD lack access to opportunities to housing, and this committee has an opportunity to address this inequity among a protected class. My son is a part of the IDD community. Westmore has also asserted that we shall leave no one behind, and that includes individuals who've received support from the DDA. The DDA rent subsidy is a tool in the toolbox that my staff uses in order to access housing for persons with IDD. We are in the middle of a housing crisis. Fiscal year 23's budget included making sure we support individuals with IDD. And I hope the fiscal year 24 budget does the same and we continue to grow that. So thank you very much for the opportunity, and I appreciate all the work that you do.
Thank you, and thank you to all that testified. Colleague, this will end the hearings for Health and Human Services Subcommittee today, and look forward to seeing everybody tomorrow. Thank you again.